Welcome to Webinar Wednesday, everybody. Thank you so much for coming. We really appreciate you taking the time out of your day and listening to what we have to say. We hold these every other Wednesday from 1:30 to 3. There are CEUs available. So if you want CEUs for today, after this is all done, it will get posted tomorrow in, sorry, I used the wrong button again. It will get posted again tomorrow with the CEU request attached. So then you can also share it if there's information you want to share with others or review later. It's there for you. The next one we have scheduled is until April 6th, but I'm still working on getting some March ones in there for us. But Mind Matters is in March too, and Brain Injury Awareness Month. So there are a lot of cool events coming up in March that you can check out on our website. Super excited today to have our speakers. We have Rebecca Reiner. She's a nurse administrator with Aging Services through our Department of Human Services. And then we have Rebecca Quinn, who is the director of the North Dakota Brain Injury Network. We're going to talk about agency foster homes for adults in North Dakota. We need some. So I think Rebecca is starting today, correct? Or is Erica? Erica, sorry.
I thought, yeah, it doesn't matter. Maybe I'll start and then introduce you, Rebecca, because you'll have some good additional pieces. I bet that'll fall into all of this after. If you don't mind, I get to go first. Okay.
Yeah, that is just fine.
Okay, good deal. Well, I will share my screen. So as Carly mentioned, I'm Rebecca Reiner. I'm a nurse administrator with Aging Services, and I am here today to talk about the agency foster home for adults. Carly, can you see my screen okay?
I cannot see your screen.
Okay, that's what I'm wondering. Here, let me redo it again.
There we go. Now it's
okay.
And then just, yeah.
Now?
Yes.
Okay, good deal. All right, get through that first difficult part. Okay, so I'm Rebecca Reiner, nurse administrator here. I'm going to talk about the agency foster home for adults. I'm one of the program administrators, so I oversee the agency foster home and then also programs Rehab and community support. So we'll go through quite a bit of information today. So first, we'll kind of go through what the definition is of an agency foster home for adults. As Carly mentioned, we don't have any in the state currently, but we do have a couple people working on this now, a couple agencies. There's a lot of different layers and pieces to it. We'll talk about the services, Rehab and community supports as well, which a lot of you might be familiar with. I've done past presentations on these programs before, and they relate to the foster home, and we'll talk about how. And then the provider requirements in becoming a provider for this service and the licensure of the home itself. And then also Rebecca Quinn will come after, and she'll kind of talk about different models that she's seen or kind of researched in the past that kind of look like the agency foster home model, but what they're doing in other states. And so kind of give us an idea of what that might be, since we don't have any yet here. And so first of all, the setting. So an agency foster home for adults, it's really the setting where an individual who has Medicaid can receive home and community-based services, programs, residential habilitation, and community support. So only individuals who qualify for this level of service, these programs, would be able to live in this agency foster home for adults. And it's a licensed home-like setting where these programs, where Rehab and community supports can be provided, and it's for up to 4 adults and up to 24 hours per day by a qualified service provider agency. So a lot of different pieces in that. So first of all, we'll look at the services. So these are the services that can be provided in the agency adult foster home, Rehab and community supports. Really, these programs are both formalized training and supports that are provided to eligible individuals who require some level of ongoing daily support. These services are designed to assist with self-help, socialization, and adaptive skills that help that person really reside independently in the community and participate in an integrated community. Rehab and community supports may be provided in a community residential setting leased owned and controlled by the provider agency, so an agency adult foster home, which is what we're talking about today. Those services also, as a side note, those can be provided in an individual's home environment as well. So this is another setting where these services can be provided. They're meant to be a higher level of services and all-inclusive care. So I know a lot of you may have seen this before. This just points out kind of where these programs fall within our home and community-based services. And so individuals who qualify must qualify for our Medicaid waiver level of supports. And so community supports and Rehab programs fall under Med waiver. So a person would have to qualify financially and functionally in order to receive these services and then be able to have these services within the agency adult foster home. And so first of all, we'll talk a little bit about Rehab briefly. So a person would need to be Medicaid eligible, like we talked about, and under Medicaid waiver, and meet skilled nursing facility level of care. The person would need to have a daily need for services up to 24 hours per day. Supervision can be part of that, but not the only need. There has to be other daily needs that that individual has. And really the goal is to assist with socialization, skills training, and maybe restoration type activities. And it really is meant to help that person reside in the community. So our target population for Rehab is a traumatic brain injury, stroke, or early stage dementia. So our individuals with a TBI really fall under Rehab because often they require maybe some level of cueing, kind of helping direct their care. They're maybe not as physically disabled, but more need that cognitive oversight and support. And so they would fall most of the time under Rehab. So service tasks and activities are meant to be all inclusive, like we talked about before. So within that agency adult foster home, that person could get all of these services wrapped up in one if they qualify for Rehab. So we're looking at education and training, assistance with activities of daily living and their IADLs, personal cares and homemaker, med management, community inclusion activities, social and leisure skill development, and then protective oversight and supervision. So all of those things wrapped up into one, and then care coordination. So the agency QSP or provider would also be providing that care coordination while they lived in that agency foster home. So just a quick snapshot of maybe someone that would fit under Rehab, like we talked about, someone with a traumatic brain injury really would fit under Rehab because they have that cueing need, maybe personal cares, they can do them, but they need someone to help direct them to complete the task. Homemaking, maybe they can participate, but they need that person there to kind of direct them and make sure that they're, doing these things every day. Medication administration and queuing, grocery shopping and assistance with meal planning, any social integration and community inclusion, taking them out into the community to participate in different activities, maybe groups, different things like that. Medication or medical coordination, maybe that person has a lot of different medical appointments. That provider would be responsible to take them to these appointments. And so that person living in the foster home would get all of those services. And so the average cost estimate for the provider for 24-hour care would be $889.36 per day. So it's paid for at a daily rate. So community supports is really essentially the same idea, but it's meant to be more maintenance care. So I could see, we've had a couple situations. So someone with a brain injury could possibly fall under community supports as well if they're really having more physical dependency or physical needs too. So maybe in conjunction with other, medical needs and issues, then they might fall under community supports as well. So really we're looking at someone, again, same qualifications, Medicaid eligible under Med waiver. They'd have to meet skilled nursing facility level of care and have that daily need for services. Again, supervision can be part of it, but not the only need. And then it's meant to be more maintenance care. So it's really someone with more complex medical needs and high physical ADL needs. So the same service tasks, except for really, we're not working on any education or training of any kind. This is really just more maintenance care, more physical dependency and needs. So maybe they, need a Hoyer lift for transfers. It's, more dependent on that care physically. So same basic tasks that would be included. And so with this person, this could be a picture of someone maybe with a stroke, again, maybe a brain injury. It just depends. It could be both of those things, where they really physically need help with personal cares, homemaking, that medication management. They need full assistance, grocery shopping and making meals. They need someone to just do that for them. That social integration and community integration piece is also included. And then the medical appointments and transportation and care coordination all wrapped up. So not every person in here may need 24-hour support. It might be intermittent needs. And so say this person maybe didn't need a full 24 hours, they needed 15 hours per day of care. This just gives a general estimate of what that might look like. So it's paid again at a daily rate. So it'd be the $37.06 per hour. And so this person might be, $555.90 per day as a cost estimate for that. So again, just highlighting the difference between these programs. Rehab is more skills training, whereas community supports is no training component, and it's really more that maintenance. So individuals in that foster home would need to qualify for one of these programs in order to live there. So our rates, a little bit more on that. Our direct service rate, the daily rate is $37.06 per hour. And then our maximum, so that would be the 24-hour care, is $889.36 per day. So in addition to that provider being paid for the daily cares and the services, that foster care provider also would charge a monthly rate for room and board. And so our current maximum room and board rate that providers may charge currently is $766 per month. And this is adjusted annually, just like our rates are. So currently that would be the maximum rate that foster care provider could charge for these individuals to live in the home. And then the providers aren't required to charge room and board, and they may choose to charge less than that maximum. So this room and board rate is really, that's paid for by the recipient, where the actual services are paid for under Medicaid waiver, and that's under our Hcbs programs. So the foster care provider would charge that recipient, that care recipient, the room and board rate, whatever they established as the rate. And another important piece of this is that our home and community-based services case managers are really the one to complete the assessment and help determine the number of hours and that rate that would be authorized for these individuals who would be living in the home. So on to our provider requirements, and there's quite a few pieces to this, and often the question is, where do you even start? And so the biggest piece is that to begin, the provider needs to be a QSP agency, a qualified service provider agency. And so that goes through our provider enrollment, medical services division. And so with that, there's required forms and documentation that need to be submitted. And this is all in our agency foster home handbook. And so within there, you can find all of the forms, all of the information, and how to actually apply just to become a QSP agency. Staff must meet documentation of competency. And so there's a state form number 750, and that would need to be filled out on all caregivers, all staff that would be providing care in this foster home. Staff must clear all required checks and validations, and that's also listed in the foster home handbook. So no direct bearing offenses. There's certain sites that need to be checked. And then also cannot employ a legal guardian or a family member to provide the care. And another additional piece, which doesn't apply to just our regular QSP agencies, but due to the fact that, if the QSP agency is looking to be an agency foster home provider, they also have to have all staff complete a BCI background check. And so with that, there's additional forms, of course, to fill out our 466 and 467. And those are things that you would be given when you're interested, you know, when you're working on the process, but just important to note. And then fingerprinting would also occur if the staff did not live in North Dakota for 11 years or more. So all staff, everybody who's providing any care in there would have that background check. And then another really important piece is the agency QSP must achieve our Council on Quality and Leadership, CQL accreditation. And so really CQL partners with that agency, and they work to provide recommendations and action steps for quality improvement. They help work on policy development, and really they're looking overall at individuals' rights within that agency foster home. And so I would, as the program administrator, provide you information on how to get in contact with them. There's a form that would be filled out for the provider, a request for engagement form, and they would submit that to just start the process. So those two things, enrolling as a QSP agency and that CQL accreditation, are really important first steps to even beginning the process. And so
Erica, we got a question. Can I ask?
Sure, that's fine.
If the home chooses not to charge the room and board, do they have to do that for everyone? Or can they choose on case by case who not to charge room and board to?
That's a good question. I would have to double check, but I would sure believe that you would have to, it would be the same for everybody living there for the home overall. What your rate, you would have a lease, and we'll talk about that too a little later. But I can double check about that if it's spelled out anywhere. As far as to, you know, if you can do that for each individual differently. I'm not sure. I would think the rate that you establish would be for everybody, but I can take that down as a question.
Thank you.
Yeah, good question. Okay, and then another piece to point out for the CQL accreditation, there is a cost initially, especially if you're a brand new agency just starting out. There is a cost to starting the CQL accreditation, but then there's once you've obtained or achieved that first level of accreditation, then there's funding available through the state. And so I can provide more information to people who are interested about that, but just something to point out. So in addition, for the provider requirements, you'd also need to have an agency program coordinator. And so due to being a provider for Rehab and community supports and the agency foster home, this is an additional requirement. So that program coordinator would need to have a bachelor's degree. They would really be the person overseeing all of the care. So meeting with that individual to determine if needs may be met, collaborating with the Hcbs case manager, taking the referral, maybe meeting with that person first to see if this is the right setting for them. If you can, you know, if that agency can take on that care, that level of care. They would develop the individual program plan and submit that to the case manager for review every 6 months. They'd sign all of the authorizations. They'd make sure all of the cares are documented according to the QSP protocols for documentation, which is a really important piece. They'd coordinate the care and almost act like another type of a case manager, right? Because they're really overseeing all of that care. So you'd still have the Hcbs case manager in the background, but that program coordinator is really overseeing a lot of the care, coordinating the staff, all of those things that go along with it, maybe communicating with the guardian and family. So really overseeing all that care. So in addition, all staff that are doing or providing the service in the agency foster home would need to have TBI, they would need to complete the TBI modules, traumatic brain injury modules, through the North Dakota Brain Injury Network. I would provide that information. There's 2 modules that are required, and then they also have additional modules if that's something you would want your staff to do as a provider. Dementia training modules also through the Alzheimer's Association, which I would also provide the state. Those are free to the provider through the state. And the Minot State Medication module, there's a written test and a practicum prior to any medication administration. So all individuals who are providing care could do medication administration, but they'd have to go through the med module, written test, and then the practicum prior to being certified to administer medication in that agency foster home. And so with that, a registered nurse is also a requirement for that agency to have. The RN would oversee medication administration, and they'd help complete the practicum with the employees. So they're really overseeing all of the medications. Maybe they're filling a Medi planner. Maybe they're administering some medications depending on the level of need, for that person in the agency foster home. So that registered nurse could also be your agency program coordinator. That's just an important piece. So maybe you don't want two people. Maybe you just want that registered nurse to do the program coordinator piece as well. So just another piece to point out. Now on to the additional layer that goes along with all of this. So licensure of the home. And so there is the chapter 5011, which is our century code for foster care homes for children and adults. So that applies to the licensure. And then chapter 750321.1 is the licensing of agency foster home for adults. That's the administrative code. And so that really has all of the pieces. And there is a lot to go through. So I have highlighted some of that in the presentation, but there's also additional pieces. So if someone was interested, they'd really need to read through this code to make sure they're kind of catching all of that. But the administrative code, again, that's really where you're going to find a lot of the licensure criteria. And then the home and community-based services case manager in the human service zone that this home would be in would actually complete the licensure of the home. So we'll go through some pieces of the administrative code. Facility requirements. The facility would need to be free of hazards that affect safety of a resident, any damaged flooring, broken windows, loose handrails, those kind of things. It would need to have a central heating and cooling system at a temp of at least 60 degrees, and this is directly from the code. Handrails would need to be in all stairways. Non-porous surfaces for shower enclosure and safety mats in tub and shower, kind of a given, some of those kind of things to make sure that the bathroom is overall safe. Physically accessible for the resident, and then a telecommunication device on the main floor available. So physically accessible for the resident is one piece that's come up quite a bit. So, with that, what does that look like? If you have someone that is in a wheelchair, how are they going to get in the home? You need to have a ramp on the home to get in. Those kind of things we might be looking for on licensure. And in addition, the home would need to be obviously a home-like atmosphere is what we'd be looking for, accessible to non-ambulatory residents, visitors, and employees. So I think this is another big key. Even if you didn't have a non-ambulatory resident living in the home, technically it needs to be accessible to any visitors or employees that might be non-ambulatory. So something to think about as well when looking at these homes and modifications that might need to be made. There needs to be a space for privacy and appropriate access to quiet areas where that person can be left alone. And then another key piece, it must be located in residential neighborhoods, reasonably accessible to shops, commercial facilities, and other community facilities. And then it also must be located not less than 600 feet from existing group homes, day service facilities, long-term care facilities, other agency foster homes, or institutional facilities. So it's meant to be integrated into the community, right? And so we're looking for somewhere that is not institution-like, that it really is in that, community, integrated into the community.
Erica, we have another question.
Yes, sorry.
Sure.
For agency adult foster home licensure, the Hcbs supervisor completes the licensing, correct? Or can it be the Hcbs case manager or supervisor?
Right. Yep. And just depending on how each zone is run. And so initially, because we don't have any of these yet, I would probably be involved as well because we're all learning this together. And so, but it could be the case manager or the supervisor. There's nothing written that it has to be the supervisor. But depending on how it's handled in each zone, if you have there's also adult foster cares, and sometimes, the Hcbs case manager does that licensure. Sometimes it's the supervisor. So it would be looked at that way as well. So yeah, just kind of depends.
Okay, and then another question, would a hospital swing bed count towards the 600-foot rule?
That's a good question. I would probably need to look at the code again. Let's see, because it talks about institutional facilities, what is the definition of that, right? So that might be something I would take to legal. Yeah.
I would think
would you
so,
say?
because a hospital swing bed, I mean, I would
It's
see
like
it as kind of that
institutional.
institutional facility.
Like a nursing home in a way, like a rehab type stay. Yep. Yeah, I would agree with that. So that's a good question. But I can take that back too as another point to double check on with legal too, as what that definition is. Good question. Okay, so in addition, the bedrooms, the bedroom requirements, so must provide at least 100 square feet per resident in a single bedroom room, and say that the foster care home decided to put 2 people in a room, it would need to have at least 80 square feet per resident in a double occupancy room. Now, really the single, the one private bedroom would really be ideal. But say that, you had a home that you were thinking about 2 people in one area, there would need to be that 80 square feet per residence in a double occupancy room. And then they all need to be able to, have the opportunity to furnish and decorate their rooms as they choose. And I should point out, a lot of this, some of these pieces are different, but a lot is similar to the adult foster care licensure and requirements for that home. Must provide storage for clothing, which is accessible to all, including non-ambulatory residents. The bedrooms in a level of the facility below grade level, so in the basement, must have 2 means of egress, one of which leads to the outside of the facility. And so often in these older homes we've been seeing, it's, a lot of them don't have an egress window. And so that's something to really pay attention to and look at, with the fire marshal inspection, which we'll talk about. That's another piece of the licensure, to have them look at that, like, is this window an egress window? Or maybe the realtor, whoever you're working with, might know that, but that'd be something that you would want to make sure of when looking at homes to provide this care. And so 2 means of egress, one of which leads to the outside of the facility. The kitchen, just a couple of things in there, must provide sufficient space to permit that person participation by both employees and residents to prepare food. So if they're working together to do those things, there just needs to be enough space to do that. Must provide appropriate space and equipment, including a 2-compartment sink. The bathroom, this often has come up as an issue. So at least 1 bathroom per facility must be accessible and usable by non-ambulatory residents, visitors, and employees. So that's one thing in some of the older homes, looking at that, how big the bathroom is. Are there modifications that will need to be made to make sure it is accessible to someone who is non-ambulatory? Laundry. Must provide washer and dryer, storage for laundry supplies, and accommodations for ironing and counter space for folding clothing and linen. So just another additional highlight out of there. And then water supply and sewage disposal must be located in areas where public or private water supplies approved by the Department of Environmental Quality are available. So if it's in city, limits, most often it's going to be fine. It's going to be approved, but that's something to just think about too. An emergency plan, the agency has written plans and procedures for the emergency, including fire, serious illness, severe weather, and missing residents. Requirements of state law and regulations by the state fire marshal and applicable licensing authorities must be met as well. So again, that inspection by that state fire marshal would be important to get some of these pieces in place. And another highlight I just had thrown in here as well, the meals and nutrition. There's a lot of pieces to this. So 3 meals must be served daily. Access to meals and food at any time, and meal choices must be provided. So say that there's an individual that this is really a health and safety issue. They can't have access to food at any time. So any restrictions to that person would really need to be documented and justified in the person-centered plan, so that Hcbs case manager would include that in their person-centered plan, and the provider should also be looking at that as a restriction, and that should be in the individual program plan that the provider is required to establish. And so just another important piece, if there's any restrictions, that would be documented and why. Each meal must be nutritious and well balanced, no more than 14 hours between the conclusion of the evening meal and then serving breakfast. And then adequate amounts of food available at all meals. Thinking about the person's cultural, ethnic, and religious backgrounds in food prep would be another part. Meals must be regular and routinely prepared in the facility where that person lives. And then, just another part that's within code, any charges for resident meals provided by individuals or businesses that are other than that provider would be paid by the provider unless they made a meal available at the facility. So just some things to think about when thinking about the meals, because that's another big piece of running the agency adult foster home, obviously, is those meals. In addition, just another list for the licensure, there's so many pieces. And so I know it can be a little overwhelming looking through all of this, but the Hcbs settings and experience interview. So that's something that would be done 30 days after opening. And really, that's just looking to make sure, that person's rights are met, that they're satisfied with the care, all of those things. It's looking at that and doing that interview. The Hcbs case manager would do that. And then at license renewal time and upon evidence of any non-compliance, they might do a settings and experience interview. And then some other additional requirements: inspection of the heating and electrical system, proof of auto insurance, any water testing if that's needed, depending on where that house is located. Floor plan would be required, which would be drawn to scale showing use of each room and showing the sources of utilities and water or waste disposal, any pet vaccinations if there's pets, sample meal plans. And then with that, the agency foster home provider would also have a service and lease rental agreement as well. And so that's something we could provide an example of if you requested it, if there's a provider looking into this and wanting an example of an agreement, we could provide that. And then examples of service logs, so how that documentation is going to be provided. And that really, when you submit for your QSP agency enrollment, they're going to be looking for documentation, like your samples of documentation as well. So some of this might be met already within that enrollment as a QSP agency. And then there's also a fire safety course completion and self-declaration form. So a lot of different pieces that go into it. So obviously, there'll be a lot of questions. It's all new to all of us. And so we're all learning, and often, there's a lot of questions, even definitely from my side too. And so if you do have questions, you can always reach out. If I don't know the answer, I definitely look into it. And then I know Rebecca also was going to provide us some examples of this type of model that are being done in other states, unless there's other questions prior to that.
Yeah, does anyone have anything for Erica? You can wait till the end too, but oh, here we go. Here's one. What would you say is the main difference with this program and the adult foster home program?
Yeah, so the agency adult foster home, it's an agency provider, right? So it's staff coming in and out. It's staff 24/7. You'd probably have at least 2 people working in there. They can, I think that's the difference. They're not living there. It's an agency. And it's really meant to be kind of a step down from a higher level of care. Only Medicaid waiver can be in there. So people that skill at a nursing facility level of care could live here. And I guess, yeah, so there are a lot of similarities, but the types of services that are in there, the idea that it's an agency foster home. So, some more training that's in there, medication administration training. So that higher level of services is kind of what would make it different, I guess.
Yeah, and so I guess I can kind of add on to that. part of the reason why we sought out this level of care in the state was because your traditional adult foster care model, we found wasn't meeting the need for individuals with brain injury. Particularly individuals with brain injury, you know, individuals with early dementia, stroke, for individuals that required a more intense level of care. Your traditional adult foster care model, it really relies on a single individual. And that works for some maybe individuals that require a less level of care, and there's that ability for that home-like environment to kind of be like a family caregiver type environment. But we were finding that for a lot of our individuals that required more, you know, that cognitive supervision and being able to do that constant monitoring stuff, it was a lot for a single individual to take on. And so we really found that that level of care wasn't the best fit. And so in looking, and so now I'll kind of wanted to talk about that back history and what's seen in other states. We saw that other states, they had this agency foster care, this agency model. And so and this was something that we've worked on for quite a while in the States. So I was really happy when it finally, I mean, when I say quite a while, I'm talking like 10 plus years, this had been an advocacy in the state to really develop this level of care in the state. Something that, you know, and so what would it look like? You know, one of the things that we know is there is currently, we have very little options in the way of group home or group residential living for individuals with brain injury in the state. Along with you know, part of right now we're talking about agency adult foster care, but the service of residential habilitation can also be provided in an individual's home. Really with the advent of the option of community supports and residential habilitation and the agency foster care, that was really the first time that you can have that up to 24-hour comprehensive services, whether it be in somebody's home or in another setting, other than we do have our 2 10-bed adult residential in the state. So those are High Soaring Eagle in Valley City and Dakota Point and Mandan. One of the things that we kind of continually have found is that unfortunately, High Soaring Eagle and Dakota Point, there's kind of a bottleneck. They're, you know, perpetually kind of full. I would love it if there was more turnover, more options, but there's really not. And a lot of times, even when individuals want to transition out of that larger 10-bed adult residential, there wasn't a step down option. And so the idea of this is to be creating that step down option. And another thing is that although both 10-bed residential are, you know, great, you know, good facilities, for a lot of individuals, that's still a larger group environment and doesn't have quite that same, like, it's their own home feeling like that they would maybe want. And so, you know, needed an option. And so the hope was that this would be that option of what else is there. Another piece that we perpetually at the Brain Injury Network get a lot of questions about is REM Minnesota. Minnesota does have dedicated brain injury group homes. And so does have very similar model of this small group living homes. And so this is just where REMs, but there are other, there's even one in Moorhead, not run by somebody else. But we would often get asked about these, you know, people would say, well, there's a home in Crookston, you know, it's just right over the river. Can we not have our loved one go there? And, you know, unfortunately, with the way Medicaid funds and works, you can't, you know, access those to the state. So that was also part of our advocacy, is how do we get what the services that people are seeking in other states, get them here? And so that was kind of part of our, you know, really kind of wanting to work on that and that advocacy piece. Because it is a question that we get repeatedly asked. I would say that it is probably the number one question we're asked is for residential options for individuals for brain injury. You know, and so I also pulled, here is from also REM, Wisconsin. And I just pulled this. These are a couple ads, this one and the next one, that I've saved over the past few years because I liked the way the ad was set up. I kind of saw them and was like, that's what I want us to have in North Dakota. You know, it's set up as just a how, you know, it basically reads like a rental ad that, you know, my daughter who's looking into apartments right now, this reads like something she would be looking at. So it has that sense of just community integrated normalcy, you know, and so it's, you know, a licensed adult family home, has 4 large private bedrooms, 2 bathrooms, 4-season porch, backyard. The program has a van available. But I really like the 2 gentlemen and 1 woman currently reside in the house, and they are seeking a housemate to share their home with. You know, it's very much, these are individuals that are just living in their home that they're renting. And oh, by the way, they happen to be getting services too. But that's the secondary piece. That really it's seen as these are these individuals living in their home, living their lives, and as part of their, and you know, it does say the house is double staffed from 6 a.m. to 10 p.m. and single staffed during the overnight hours. You know, there's also periodic triple staffing to allow for group or activities. So, but I just really kept this because I like the way that it's set up. You know, in my idealized view, I would really like to see this is the type of thing that I'm like, this is what we're trying to go for. And then the next one, similar, Jefferson Street is a newly opened adult family home to support individuals. This one was a behavioral challenge, brain injury behavioral challenge one. 4 private rooms available. You know, home is located in the quiet West Bend neighborhood. You know, licensed to support individuals with developmental disabilities, mental illness, or brain injuries. Staffing patterns will be developed to meet the individual needs. And so very much you can see it's still set up as a, like, this is these individuals' home. This is, and we're going to tailor staffing around providing it in these individuals' homes. So Iowa has some really fabulous, I actually toured this exact home when I was in Iowa. And I will tell you, the home is absolutely gorgeous to where I wanted to move in. What Iowa did, the community neuro rehab in Iowa at really the bottom of the housing market, went and bought some really beautiful homes. So, but the community neuro rehab, and this is actually pulled just kind of from their website. Basically the idea that individuals with brain injury can best generalize their gains into a community setting when they receive services in the community, thus promoting the reacquisition of daily skills and the use of strategies that will maximize access to community living options. So when I went to tour this facility in Iowa, it was definitely something that to me, I was like, yeah, that's the type of thing that we need. It's set up that the individuals very much self-direct their care, even to the point that when I was there, they do have access to a van. But it's the type of thing that if an individual has a doctor's appointment, then staff prompt that individual to reserve the van and prompt that individual to, so there was a whiteboard where the van was reserved on. And there was actually an individual there that when I was touring, he hadn't reserved the van, but he had a doctor's appointment. And the staff said, well, but the van's not available. The van's gone for the day. So how are we going to get to your doctor's appointment? You didn't reserve it. Okay, well then what are we going to have to do now? And so prompted and walked him through calling his doctor to reschedule the appointment. And then when it was rescheduled, then prompting him to, okay, but this time we need to make sure that we do this van, reserve the van, and prompting him to do that. And so it was very much set up as the individual really having to direct all of those steps and staff prompting them on that. Not so much that the individuals are just doing everything for the individual, but really that complete prompting that the individuals to really work on gaining really those daily living skills and to help transition. And so that, you know, that piece of that, how to, you know, gain those skills, because one of the things that community neuro rehab really has tried to work on is then transitioning people even out of the agency foster home into community and being able to say, okay, this is now the level of support they need now in an independent, living environment. So moving them into an apartment where they maybe then only need like 5 to 6 hours a day, and then transitioning them from even less. So working on that scaled down process. Similarly, Colorado has many assisted livings. Here's a website of one of them that you can go look at and see. But same concept of their, as we've talked about, they're in residential. Part of the reason why I pulled the pictures from the websites of these actual houses is so you can see how they are. They're just regular houses and, neighborhoods that you wouldn't know. Back to when when I toured the Iowa one of the things that they had done as part of their rehab was they had set up, one of their houses had, a grounds crew that would then go and volunteer throughout the neighborhood that they were residing in to help out with yards and things for any seniors or anybody in the neighborhood that needed that, and work with them on that. So on skill development and so things like that. So really having it come part of the neighborhood. He talked about the fact that in one of their neighborhoods, there's traditionally a, neighborhood picnic at the end of the summer, and they made sure all the residents went to the neighborhood picnic, and that part of socializing and really having it be a part of the residential community. So those were kind of the pictures I had. That is what I wanted to share with you guys, just how it could look. But really happy to answer questions. As I said, this is a absolutely needed service in our community. I will say we've had, I think today, about 48 of you on at one time today. So definitely something that there is interest in. So wanting to have it be a reality in our community. And I know we have some that are getting closer and closer. And so it's one of our things at the Brain Injury Network and Erica that we really want to work on whatever we can do to help move it forward in those next steps. So one of the things, as Erica did mention in her piece, you do have to complete the brain injury training. We do have 2 of our online modules that you can complete, or some of the things that we have done is done more an all staff training with setting that up with the Brain Injury Network, and that can work as well. We have worked with Erica that can work as well. We provide certificates and do that. We have had some providers that are providing the residential habilitation that we then have done follow-up technical assistance calls with them, if they're struggling with an individual or a couple individuals. We had one provider who, they then asked their staff what questions they would have for us and submitted the questions in advance so that we could really kind of help field those questions. And I think that was helpful for staff, being able to ask in advance and not feel put under pressure on, a Zoom like this, but being able to just ask those in advance. So doing that. So more than happy to, that's kind of our role through the Brain Injury Network as to how we can help and support that as part of that training and developing resources for you.
Yeah, that's a good point.
I don't know if anybody has any questions for myself or Erica, or thoughts or ideas about developing this.
And good point. Like, you guys are willing to do individual consults even, right? I mean, if there's particular people that are, challenging in any way, and if there's questions, you're willing to help figure those issues out and develop a care plan, those kind of things.
So here we have some questions. When homes are approved, will this be posted to the public or posted on the MD-BIN resource list? I would say both. It would be listed on the QSP service list online, where you could check it as a box and it would show up of who's approved for that. Also, we would then add it to the resource list as well. And yes, somebody asked about, so can you share the agency foster care slides, please? Yes. So traditionally after our webinar Wednesdays, Carly gathers the slides and then posts them online with the recording of it. So yeah, she said all slides will go up tomorrow. Let's see. Are any of the agencies working on this process in the Fargo area?
Erica? So Yep. Oh, yeah, we're lacking providers in Fargo, I think, for these services overall, but we have I've had a couple questions from Fargo and some individuals who are looking to begin, the agency process of becoming an agency QSP and start that process. So I've had a couple of people interested, but that, are very in the very beginning stages, I would say. But I can keep you guys updated as they move along. Once they're enrolled as an agency QSP, then hopefully it'll move a little quicker, but it is a bit of a process for sure. So there's a couple in Fargo with questions, yes.
And then another question, the initial cost of obtaining a house and a van, would that be covered through Medicaid, another company, or would individuals starting the house be responsible for those costs?
Yeah, so the agency, would purchase the home and they would be responsible for the costs of that. Yep. And I mean, there were some grants out there, and I don't know if all that information's been released for individual or agencies who are interested to assist with some of those startup costs, but going forward, I mean, it's the agency's responsibility.
So yeah, it is an agency's responsibility. But as Erica said, there were some grants. I'm not sure where those are in the cycle. This service it's definitely something I've advocated, almost where I feel like I'm a broken record of the need for this service, to the point that it was definitely something that was priority given for wanting to open this type of level of care, for the Money Follows the Person grants and some of the other specialized COVID grants and things like that. So if you are interested, definitely be looking for those type of things. Some of those I think were the Money Follows the Person ones were like 30,000, but then up to I think 50,000 if you were wanting to open an agency foster, or I think they had some extra funds if you're wanting to open. So, I mean, there is some options out there. Other things to maybe look into is I know sometimes people have looked at HUD funding. So housing and urban development funding and some of the other funding that is available for those type of things on grant side. So, so that is, I would say, something that I'd be happy to help look into if you are looking for, if there's somebody that's interested and wanting to look at funding, I'd be happy to kind of assist and help with that. Any other questions?
I do see one in there. Are residents usually able to afford room and board out of pocket costs, since Medicaid waiver doesn't pay that cost? And that's a good question. I mean, we don't have any yet, and I'm not sure what other states have seen. But that's a good question as far as affording the cost. But that includes your meals and your, transportation and all of those things too.
Yeah, traditionally it would be because that allowable room and board rate is pretty much set across long-term care. And usually that's the, individuals receiving Social Security disability, minus their, some spending money and things that they have. So typically that is, if somebody's on the Medicaid waiver, then usually they are getting Social Security disability, so that would come out of that cost. And then this is one that a little complicated for me, Erica, as far as answering. So rides to medical appointments regarding if going via agency van or public transportation, would the staff from the agency be able to stay with the person at the appointment?
Yeah, and that's really the idea. And so, and I thought, Rebecca, you had a good example in one of the pictures where it said sometimes this, house is staffed with 3 people, so people can go out into the community and some stay there. However, it has to be, the agency would be responsible to staff for that. So if they knew that person needed someone to go with them to that appointment, then you would expect that they would staff it.
Thinking about it as a 24-hour inclusive service.
Mm-hmm.
So whether
there's always
that,
someone,
if that individual is going to a medical appointment, then yes, part of that's part of their 24-hour day.
Mm-hmm.
That would be, so staffing wise, you would want to think about that, that ability to have one staff stay back and when
Mm-hmm.
another go with it, an individual. But same thing as far as going to the library, community outings, it's a 24-hour inclusive service, but it's not meant to be provided just at the home, but that, wherever that individual goes throughout their day, providing that care and service.
Yeah, good question. Mhm.
Are there any agencies currently providing 24 hours care for Rehab or adult foster care?
So currently 24/7 care, yes, we do have some agencies that are providing that service, the Rehab or community supports. We have quite a few 24-hour, but the issue, of course, is staffing. And so often it requires time for them to hire, which is one of the issues. The foster care, agency foster care, we don't have any yet. Adult foster care, we'd have to check on availability throughout the state as far as the 24/7 care. Good question.
Yeah,
Add-
so I mean, the Rehab, how many providers are approved now for providing the Rehab?
Yeah, so currently there's 11, but some are more active than others. And so there's 11 approved and a couple that I would say, let's see, probably one that isn't providing any of the services yet, and the rest that have at least one or more that they're providing care to.
So I mean, and that has been, and as Erica said, staffing has been an issue with that. But we have been able to successfully, we've transferred a few individuals from the state hospital over the past year into 24-hour care in community with Rehab. It did take, as Erica said, some time of working with the provider and hiring up specifically for that individual. But it has been able to be utilized as a service since its development. One of the things to me, a benefit to me of the agency foster care is being able, to me, staffing a foster care home with 3 or 4 individuals on it, to me would be easier than staffing 3 or 4 individuals in their own apartments.
Right, one-on-one,
So
right?
although it's maybe not as community integrated as it could be, it still is an option that would allow for more individuals to get services within kind of the same amount of staffing, a little bit easier staffing model. And there have been reasons for me, because sometimes I feel like I'm having to advocate for why even have this level of care versus complete Rehab independent living homes, is there are some individuals that for health and safety reasons, it is better to have them in more of a group environment. There have been some where there have been concerns about doing complete just one-on-one staffing in their own apartment. So this would allow for, a 2-on-1 staffing settings, that ability to have backup. I will say for some of the agencies that we've provided some of the training for as far as the Rehab, and I feel like I've warned people about this when they're, thinking about it, is individuals with brain injury, it can be intense working with them. And so it is nice to have another staff member there as backup to be able to walk away from situations when things start to, be able to say, okay, I'm getting a little frustrated. It's time for me to step back and allow, may you take this individual for a walk so that I can have some. And so agency foster care home would allow for that staffing and being able to hopefully help with some retention of staffing by allowing that. Whereas your complete Rehab doesn't allow that as much. But we have had success with Rehab. It just would need more, and more, it's kind of a tough option. So, but good question. Any other questions? I will say, Erica has been wonderful to work with, to kind of, give a great shout out to Erica. Erica was new to DHS as far as taking on these projects, and new to this idea of like, these were brand new programs, and really kind of like, you've embraced them and really, really worked on with agencies and helping walk them through the process of getting set up and which has been wonderful. I don't know that we, adding COVID has not been easy as far as setting up. These projects were, rolled out in winter of 2019, 2020. So right as COVID was hitting was when these were rolling out. So it hasn't necessarily been easy, but I'd say that, Erica has been phenomenal to work with as far as helping with agencies and, getting an understanding of this as new services.
Thank you.
We've
Nice of
been
you to say.
delighted to work with Erica as far as setting it up. So thank you very much.
Thanks for saying that. Yeah, I mean, and the point of these webinars is really to reach out and gather if there's more providers or interest in any way, always willing to do presentations. I think the information Rebecca presented was really helpful, even for me to see some models and ideas of how that looks in other states. So willing to talk to, other providers about that too. And bear with me as the process is a little choppy since we are learning, it's all new and often have a lot of questions myself. So.
And I say that as well as far as like, I think the screening is one, and as the setting up the funding rate, that's another one that really, while we're learning this process, really getting an understanding of what the level of care needs of individuals with more cognitive supervision needs are and what the intensity of that. So I really think that, and that's why it's been great working with Erica, being able to really do the hand holding. Earlier there was the question about who, approves, and Erica saying, well, at this point, you're going to be really involved as well as the human service zone. And so it's been great doing that. So another question, if someone living in Minnesota or South Dakota and currently on Medicaid in that state, could they move to North Dakota and apply for North Dakota Medicaid to utilize this program? I would say yes. Somebody would just have to come to North Dakota, back to North Dakota I don't know if they're necessarily from, but yes, they would have to move to North Dakota and apply for North Dakota Medicaid to utilize this program. Particularly over the years, we have had people from North Dakota that have moved to, because if North Dakota Medicaid is paying for long-term care in another state, after 2 years, you have to drop your North Dakota Medicaid and apply for Medicaid in that state. So we have over the years have individuals that have left North Dakota to seek services. So they, definitely for those individuals coming back, it is a process of just applying for Medicaid as part of that. And that be something that, the human service zones would be, where you would start with that in that process. So other questions? Somebody said, thank you for doing this today. This is something that we really had wanted to do. We did a brief overview of them, I think about a year ago. With Erica, but at that point, wanting to have some time of really Erica getting a handle on it, really a good understanding. And at that time, we really focused more on the residential habilitation, whereas this time really wanting to focus on what does agency foster care look like? Since it is a new level of care in our state, just even having that understanding of how is it different than that question asked earlier, how is it different than your traditional foster care? So,
anything else then?
Anything
it's always
else?
In the end, you're like, all right.
Well,
Right?
as we are always here, more than happy to answer questions, work together on things. Feel free. How many of you working with different populations, reach out if they're ones that you're trying to kind of think about what would be a good fit. We're always trying to find out, what services we can be better developing for individuals and finding fits for individuals.
I'm going to add one more thing that came up based on one of those questions earlier. If it's the case manager that would license this or the supervisor, the Hcbs supervisor, and I have found that it's Hcbs supervisor. So I spoke incorrectly. Just want to clarify that it's the supervisor that would do the licensure. And I would, of course, be working with them too.
So perfect. Thank you.
All right.
All right, thank everybody.
Thank you, guys.
Yeah, that was great. Stop recording.
Thank you, everybody. And as Carly said, she'll have the slides up tomorrow.